So my name is Faye Lee. I am an international studies major and I'm in my senior year right now.
Okay.
Kuala Lumpur, Malaysia, which is where I currently am right now.
Okay.
Joyce, this past week. Well, I would say I restarted my assignments. It was really hard for me to stay motivated because of every week is something crazy. Like every week is just something big and something new that's happening. I either have to move to a hospital or get back to quarantine or all that kind of stuff. And, being able to stay focused and really put all my energy into the assignment and not worry about anything else is what's been a big challenge for the entire time that I was in this situation. And I don't know, one day I just woke up and I was like, I feel like doing my assignments today, and I did it. And I've been going ever since. So that's been really helpful. And being able to reconnect with my professors and, updating them and them updating me, it was just good to hear from them. And I think that that was one of the highlights of my week. When I came back for quarantine, they gave us this sheet that's like a 14-day period. So in there they have a checklist. They're like, do you have any of these three symptoms, which is cough, sore throat, and fever. So every day you'd have to check it off. And they'll call you as well. Like they're gonna call you to ask if you have any of those symptoms. So one day I woke up with like a high fever and sore throat, and I was like, oh shoot. And they called me and they asked me about it, and I was like, yeah, I have like two of those. And they're like, all right, we're gonna send someone up right now. And they sent some doctors up, and I was expecting the doctors to test me, and I would like wait here till the results come back, but they're like, pack your bags, you're going to the hospital right now. And I was like, what? And yeah, and I packed my bags and I went to the hospital. There was an ambulance waiting downstairs for me, and um, I was asking them like, how's the procedure going to be like? They're like, oh, you're just going to stay there, like, for you're going to stay there for a while, and until your results come back, you're going to come back here. And I was like, oh, okay. And so I went there, and the hospital was pretty far. It was like quite a drive. And so when I was at the hospital, I was led up to a ward, and at that ward it's like an open space, so there are like other patients. We are all in this one big room together, and we're the only thing that's keeping us apart are these curtains that you can just pull, that to make your own space, and that's like pretty much it. But when you're there, you're just exposed with everyone else. There for I stayed there for 3 days, 2 nights. Yeah, because they swabbed me twice. They
Mm-hmm.
wanted because they've been getting like false negatives, and they take my blood and they take my like my nose swab at the same time. I stayed in the hospital for I stayed there for 3 days, 2 nights, and yeah, there were other patients with me as well. They all were fresh. They just landed from the UK, so I was like the only one who was in the quarantine, and then all of a sudden had symptoms and had to be hospitalized. And yeah, so yeah, when I was there, the nurses they frequently checked up on us, and they would just do like basic checkup every day, and they swabbed me twice just to make sure like the results were negative. So they took my blood and they took my the nose swab as well. And yeah, so um thankfully both times that I got swabbed, I got a negative result. So I was really happy about that. And everyone else in my ward got a negative as well. So we were all good. Like we got discharged at the same time. But I didn't end up going to the same hotel as them. They went to a different one because I just came back to the one that I was designated.
Okay.
I think being on campus itself and having like just not having this pandemic was a motivator. um, when everything was normal. I think it was really helpful when I was still staying on campus, and I actually didn't think that it was gonna be a challenge when I got back. I thought like when I got back, I was like, yeah, that's gonna be fine. I'm gonna be like in a stable position. I don't have to worry and everything because I was worried on campus, but I wasn't as worried as I am now. So like I thought that it would be better when I came back because I would be taken care of and everything, but um it was then my government announced that anyone who flies in is going to be mandatory quarantined. And that was when it hit me. I was like, oh crap, like I'm not going back to my house. So things are not going to be as normal as I thought it would be, you know. And so yeah, like being on campus, it really helped that I was just in an environment where I was already in the mindset to study, you know, because I think like your physical environment, like things around you, they are like stimulators for you to just basically how you respond to your daily schedule. And I think just being in my room in Baker, it stimulates me to study. Yeah. Campus, I was really well, I guess the biggest worry was like to stay or to go, because like I actually had no plans to stay further in the US like after graduation. And so the my plan was to go back, but I didn't know whether I should stay longer, because I mean my best friend was here and I I was gonna leave her like almost forever. I mean, we're gonna meet up again soon, but then like, the time for us has come to an end. And also basically my time at Luther is coming to an end. And that's what I was really contemplating about, and also the time zones and everything else. Um, but I guess my biggest worry was also like the healthcare system, because we have universal healthcare in my country, and I got hospitalized and swabbed and everything for free, and everything else like is provided by the government, and they've been providing food for people and stuff like that as well. And so I was like, they don't do this over here. So, and the thing that made like the main decision maker for me was like, I feel like it's better to get COVID in my country than get COVID here. You know, I like not that I want to, but like I was just thinking about the worst case scenario, because I knew the numbers were hiking up, and I mean, as much as I have health insurance and everything, I just didn't trust it enough to protect me, and that was the decision I made, like to go back. Like I knew I was going to be stranded and everything. I was prepared for that. I was prepared to probably stay in a transit a little longer than I'm supposed to stay. But then thankfully it didn't happen. I mean, my first flight got canceled, and that was it. Like, but we managed to get a second flight, um, to the same destination and just like arrive pretty much the same time. So um, so I was prepared for the risks because I felt like it was a risk that was worth gambling. Yeah. Yeah, so my government provides they provide free testing. If you show symptoms, then yeah. But if you just want to check, like if you feel like checking, then you'd have to pay. But generally, that's been the case. Like for people who want to have, like for people who have symptoms like me, you get hospitalized and you get tested for free. As for some community responses, nationally, we have this thing called we have like a movement restriction order. So like the whole country, no one's allowed to leave their house. Yes, you can leave your house, but for like groceries. And I'm not sure. I don't think you can leave your house for recreational activities. But basically, if you need to leave your house, it's for like an absolute emergency, because the police, like they're everywhere. And like there's this video I saw somewhere on Twitter. I don't know if it's real or not, but I assume it is. There was this guy who's just like going around doing his business, and the police just tased him, and he was yeah. Like for me, I can't even get out of my room, because like if I do, then that's 2 years jail for me. And that's like a lot of people as well. Like if you get out of your house, it's like a jail and a fine. So that's how they've been enforcing these rules for people to stay inside, unless you have to, like it's a necessity to go out for you to live. But but yeah, a lot of community responses have been like people have been doing a lot of fundraisers to help basically marginalized communities that don't have enough food or resources to get by with that. The government is also helping them, so that's really good. But people are also doing their part, helping immigrants and other people who need it. And some other responses have been, I think generally people have been really mindful. Um, people have been really staying at their homes and not traveling as much as possible. And yeah, the delivery services have also drastically increased. Like the food delivery services, grocery delivery services. We have this one app that does everything for you. So you get like all kinds of services from it, like food. Um, I don't know if you want to do shopping or whatever, you can get it from there as well. So yeah, that's what people have been mostly using. I would wake up, I would I would take a shower, maybe two sometimes. And I would just like I would work out. I started working out, and I even started napping at one point because I felt like it passed the time faster. So I was napping a lot at one point. And I will also mostly talk to friends. Like talking to friends and family is what really passes the day. And just I don't know, just keeping in touch with them is also good for my mental health. And I also started, well, I actually surprisingly haven't been watching any TV shows because I've been mostly just trying to interact with people as much as possible. Yeah, it's surprising because you'd think that in a quarantine you pass time by watching movies, but I felt like watching TV shows made time pass slower. So that's why I started doing things that I felt make time pass faster. But these are the basic things that I've been doing and assignments. Yeah. I guess what has surprised me the most is first of all I would say the response my country has done. Like it's shocking because sometimes you know I don't know, my country sometimes can seem like they aren't they aren't qualified enough to take on like a global pandemic and actually flatten the curve. But then we've done significantly well, and that was a huge shocker to me. And that was like one of the main reasons why I decided to go back. I was like, wow, like they're actually doing something effective for once, and like it's actually really effective because with all these restrictions, like heavy restrictions and everything, um, that's so that was one thing that shocked me the most. But like the other thing that shocked me the most, like in relation to that, is the US's response to this. Like it's incredible, like the things people say, when they are asked to be mindful about social distancing and self isolation and just being a partner in a community, you know, as a response towards this pandemic. It's always like I don't know, you get a lot of these responses like our economy is going to suffer, so we're going to die anyways, arguments like that. And also things, I don't know, I guess generally I was really shocked with how the US responded to it because I mean they have the technology and they have the capacity to do it. It's just that the people aren't cooperating. And I guess also like the government plays a huge part in it as well because like the responses haven't exactly been as strict as they should be, given how much the numbers are hiking up. Like I know Texas is going to reopen its state, as promised on the date, like April 30th. Yeah, that's a shocker. And like I guess what they were aiming for isn't like to flatten the curve, but to get the the numbers low enough that they feel like it's safe to open up again. But then I still think that that is, that's not something wise. And especially now that the cases have been over 1 million already. Um, but yeah, I guess I'm also really shocked by how things are changing so quickly because I know a lot of schools and everything are prepared for distance learning for probably like 2 years, I would say. And just to think that this would actually go on for 2 years, it's not surprising because SARS actually lasted for 2 years as well. But just to be part of a huge historical event is I don't know, not everyone's prepared for that kind of stuff. Yeah.
Definitely.
I would say honestly how we're doing in Asia is what's making me hopeful because, things are starting to get better here. And I guess a lot of countries as well have been responding so well to this, especially global South countries. Our responses have been really great so far, and that's what's keeping me hopeful because these are the times where we really have to depend on one another and not what global superpowers claim. Like they're capable of doing. And I think that's what's making me really hopeful of like the future for us. And but I guess in terms of personal hope, um, the calendar keeps me hopeful. Like I get to look at like how many days are left for myself and that my family is waiting for me. And basically I get to be safe in like a really safe environment where people are actually taking this seriously and being extremely mindful about it. So yeah, yeah.
That's good.
I guess yeah, I well there's one thing that I was really shocked by. Part of what are the other things that I'm shocked at. Um Basically staying sane in this room because I mean it's hard to like at one point I was like in not a great place like during this quarantine because I was like I found it so hard to explain my situation to people. Like I felt embarrassed to explain it in a way. And the reason why I felt embarrassed was because like staying in this room at one point for me, like just staying, like being present in this room was a battle. Like it became a battle every day, just being present and staying sane. And it was so hard for me to explain the situation to people because I was like I don't want people to like misunderstand me for being ungrateful or anything because ungrateful is the last thing that I felt. In fact, I wasn't even sure why I was feeling this way, but like I was just I was just ashamed because I was like, I'm given such a nice place to live in. I'm given food like 3 times a day, and I'm given security. I'm given, you know, immediate health care and all that. And, why am I still feeling this way? And that's why like I struggled so much with talking about that. And until today, I still don't know why I felt that way, but I know I felt it. And yeah, yeah, just putting it out there, like if there was one point like I was just kind of cut off from people, that was why I was feeling that was why I was feeling this way. Like I didn't know how to explain it to people. And now I'm in a position to be able to describe it, but I still can't really explain why I felt that way. But yeah, that's probably one of the reasons why I got like sick and got to the hospital because I was feeling that way because I was feeling so down and that made me realize that like your mental health matters more than you think it does because it can get to a point where it actually physically affects you. And so yeah, yeah, that was part of my experience being here. And in total, that would mean I would have to spend like a month in mandatory quarantine. So I practically didn't see humans for like a month, and I'm actually pretty excited. Like I've missed looking at people.
Oh,